81. Which of the following factors increases the risk of TB transmission? A. Crowded living conditions. B. Good ventilation. C. Proper hand washing. D. Wearing surgical masks. Answer: A. Crowded living conditions. Rationale: overcrowding increases the risk of airborne transmission of TB. 82. What is a major complication of TB in HIV-positive patients? A. Disseminated TB. B. Mild fever. C. Skin rash. D. Weight gain. Answer: A. Disseminated TB. Rationale: immunocompromised patients are at high risk for disseminated TB, where TB spreads beyond the lungs. 83. Which TB drug requires routine eye exams? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis, so regular eye exams are needed. 84. What is the primary method of TB prevention? A. Vaccination with BCG. B. Regular hand washing. C. Avoiding public transportation. D. Taking antibiotics. Answer: A. Vaccination with BCG. Rationale: BCG vaccination helps prevent TB, especially in children. 85. In which country is the BCG vaccine routinely given? A. United States. B. Canada. C. India. D. Australia. Answer: C. India. Rationale: India and other high-burden TB countries routinely give the BCG vaccine to newborns. 86. What is the first-line treatment for latent TB infection (LTBI)? A. Isoniazid for 6 to 9 months. B. Rifampin for 3 days. C. Pyrazinamide for 1 month. D. Ethambutol for 2 months. Answer: A. Isoniazid for 6 to 9 months. Rationale: latent TB is treated with isoniazid, INH, for 6 to 9 months to prevent reactivation. 87. What is the causative organism of tuberculosis? A. Mycobacterium leprae. B. Mycobacterium tuberculosis. C. Mycobacterium avium complex. D. Mycobacterium kansasii. Answer: B. Mycobacterium tuberculosis. Rationale: Mycobacterium tuberculosis is the primary causative agent of TB. Other mycobacteria may cause similar infections, but are not the primary cause of TB. 88. What is the primary method of TB transmission? A. Bloodborne. B. Airborne droplets. C. Fecal-oral. D. Direct contact with skin. Answer: B. Airborne droplets. Rationale: TB is transmitted through airborne particles expelled by an infected individual when coughing, sneezing, or talking. 89. A patient with active TB should be placed in what type of isolation? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions. Answer: C. Airborne precautions. Rationale: TB spreads through airborne particles, so negative pressure rooms and N95 masks are required. 90. What is the primary site of TB infection? A. Brain. B. Liver. C. Lungs. D. Kidneys. Answer: C. Lungs. Rationale: the lungs are the primary site of TB infection, but TB can spread to other organs, extrapulmonary TB. 91. Which symptom is least likely in a patient with pulmonary TB? A. Night sweats. B. Hemoptysis. C. Productive cough. D. Hypertension. Answer: D. Hypertension. Rationale: TB does not cause hypertension. The classic symptoms are night sweats, cough, and hemoptysis. 92. The most common diagnostic tool for TB is A. MRI. B. Sputum culture. C. Skin biopsy. D. CT scan. Answer: B. Sputum culture. Rationale: sputum culture confirms TB diagnosis, detecting Mycobacterium tuberculosis. 93. The BCG vaccine is used to prevent A. Pneumonia, B. Meningitis, C. Tuberculosis, D. Influenza. Answer: C. Tuberculosis. Rationale: the Bacillus Calmette-Guerin (BCG) vaccine provides TB immunity, especially in children. 94. What is the most common side effect of isoniazid INH? A. Nephrotoxicity, B. Hepatotoxicity, C. Ototoxicity, D. Anemia. Answer: B. Hepatotoxicity. Rationale: INH can cause liver damage, requiring liver enzyme monitoring. 95. What does a positive PPD MAN2 test indicate? A. Active TB, B. Past exposure or latent TB, C. No TB exposure, D. Drug-resistant TB. Answer: B. Past exposure or latent TB. Rationale: a positive PPD means TB exposure, but further testing is needed to confirm active disease. 96. Which medication is included in the RIPE therapy for TB? A. Vancomycin, B. Rifampin, C. Ciprofloxacin, D. Amoxicillin. Answer: B. Rifampin. Rationale: rifampin is a key drug in RIPE therapy for TB. 97. Which TB medication can cause peripheral neuropathy? A. Rifampin, B. Pyrazinamide, C. Isoniazid, D. Ethambutol. Answer: C. Isoniazid. Rationale: INH can cause peripheral neuropathy, which is prevented with vitamin B6, pyridoxine. 98. Which drug is the most hepatotoxic in TB treatment? A. Isoniazid, B. Rifampin, C. Pyrazinamide, D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is the most hepatotoxic TB drug. 99. What is the duration of treatment for latent TB with isoniazid? A. 2 weeks, B. 4 months, C. 6 to 9 months, D. 12 months. Answer: C. 6 to 9 months. Rationale: latent TB is treated with INH for 6 to 9 months. 100. TB in the spine is called A. Miliary TB, B. Pott's disease, C. Gons complex, D. TB spondylitis. Answer: B. Pott's disease. Rationale: Pott's disease is TB affecting the spine, causing vertebral collapse. 101. Which symptom is most specific to TB? A. Night sweats, B. Cough lasting 2 weeks, C. Fever, D. Fatigue. Answer: B. Cough lasting 2 weeks. Rationale: a chronic cough is a hallmark of TB. 102. Multi-drug-resistant TB, MDR-TB, is resistant to A. Isoniazid and rifampin, B. Rifampin and pyrazinamide, C. Ethambutol and rifampin, D. Isoniazid and ethambutol. Answer: A. Isoniazid and rifampin. Rationale: MDR-TB is resistant to at least INH and rifampin. 103. How long should TB patients be isolated after starting treatment? A. 48 hours, B. 1 week, C. 2 weeks, D. 6 months. Answer: C. 2 weeks. Rationale: TB patients remain infectious for about 2 weeks after starting treatment. 104. Which diagnostic test detects TB DNA? A. PPD test, B. IGRA quantiferon TB, C. Chest X-ray, D. GeneXpert MTB/RIF. Answer: D. GeneXpert MTB/RIF. Rationale: GeneXpert detects TB DNA and rifampin resistance. 105. Which factor increases TB transmission risk? A. Open windows, B. Poor ventilation, C. Wearing masks, D. Washing hands. Answer: B. Poor ventilation. Rationale: TB spreads more in poorly ventilated areas. 106. What is the primary reason TB requires multiple drug therapy? A. To reduce cost of treatment. B. To shorten treatment duration. C. To prevent drug resistance. D. To increase bacterial growth. Answer: C. To prevent drug resistance. Rationale: using multiple drugs helps prevent resistance and ensures eradication of Mycobacterium tuberculosis. 107. Which TB medication can cause red-orange discoloration of body fluids? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: B. Rifampin. Rationale: rifampin commonly causes red-orange discoloration of urine, sweat, and tears. 108. Which test differentiates latent from active TB? A. Chest X-ray. B. PPD test. C. Sputum culture. D. IGRA test. Answer: C. Sputum culture. Rationale: a positive sputum culture confirms active TB, whereas PPD and IGRA indicate exposure, but not active disease. 109. What type of hypersensitivity reaction occurs in a positive PPD test? A. Type 1. B. Type 2. C. Type 3. D. Type 4. Answer: D. Type 4. Rationale: the PPD test is a delayed type hypersensitivity reaction, type 4, mediated by T cells. 110. Which TB drug is most associated with optic neuritis? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: D. Ethambutol. Rationale: ethambutol can cause optic neuritis, leading to vision problems. 111. What does a negative PPD test indicate? A. No TB infection. B. Active TB. C. False positive. D. Drug-resistant TB. Answer: A. No TB infection. Rationale: a negative PPD suggests no exposure or a weakened immune response. 112. What is the most common symptom of extrapulmonary TB? A. Chronic diarrhea. B. Persistent joint pain. C. Painless lymphadenopathy. D. Seizures. Answer: C. Painless lymphadenopathy. Rationale: TB outside the lungs often presents as enlarged, painless lymph nodes. 113. What should patients avoid while taking isoniazid? A. Milk products. B. Alcohol. C. Vitamin B6.
D. Caffeine.
Answer: B. Alcohol. Rationale: alcohol increases the risk of liver toxicity with INH. 114. Which population is at the highest risk for TB infection? A. Elderly individuals. B. Immunocompromised individuals. C. Children under 5 years old. D. Pregnant women. Answer: B. Immunocompromised individuals. Rationale: immunosuppression, e.g., HIV, chemotherapy, increases TB risk. 115. Which country has the highest TB burden? A. USA. B. Canada. C. India. D. Australia. Answer: C. India. Rationale: India has the highest number of TB cases globally. 116. What is the best method to confirm TB eradication after treatment? A. Chest X-ray. B. Sputum smear microscopy. C. Negative sputum culture. D. IGRA test. Answer: C. Negative sputum culture. Rationale: a negative culture confirms TB clearance. 117. Which TB drug requires baseline and monthly liver function tests? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is hepatotoxic, necessitating liver function monitoring. 118. Which symptom suggests drug-resistant TB? A. Rapid improvement with antibiotics. B. Persistent cough despite treatment. C. Mild fever for 2 days. D. Rash development. Answer: B. Persistent cough despite treatment. Rationale: NDR-TB is suspected when standard therapy fails to improve symptoms. 119. What is a Gone complex? A. A lung lesion seen in primary TB. B. A drug-resistant TB strain. C. A type of TB skin reaction. D. A TB medication side effect. Answer. A. A lung lesion seen in primary TB. Rationale. Gone complexes are lung granulomas indicative of primary TB infection. 120. The WHO's anti-TB strategy aims to eliminate TB by which year? A. 2030. B. 2040. C. 2050. D. 2060. Answer. A. 2030. Rationale. The WHO aims to eliminate TB as a public health problem by 2030.